It is estimated that 80% of Americans will experience back pain in their lifetime. It is important to know that you are not alone in your pain. Sometimes the pain will be severe enough that life as you know it may have to slow down for a bit. But with the right amount of help, spinal movements, and just time, your pain can be managed and potentially diminished, allowing you to return to your activities of daily life. The goals of the following video are to briefly educate and help you with the decision-making process concerning your back pain. We will then explore the role of how to get started on a home program to help manage pain and promote a healthier back. In addition, we will briefly cover when it may be necessary to return to your healthcare provider for more help.
To better understand the causes of back pain, it is helpful to look at the anatomy of the spine and supportive muscles. The spine is divided into different regions: cervical, thoracic, lumbar, and sacral. It is composed of vertebrae, the actual bones, and discs which act as shock absorbers. Each vertebra has joints, which connect and help create movement within the spine. Tissues such as ligaments, joint capsules, and the muscles of both the back and the abdomen support the vertebrae. There are basically two major muscle types. The first types of muscles are for the micro or small movements. The remaining muscles are used for the macro or large movements. The micro movers are for precise, small motions, joint alignment, and your postural system. The macro movers are for your power and strength motions. Different parts of this anatomy can contribute to various causes of back pain. The majority of back pain comes from mechanical dysfunction, such as sprains, strains, and degenerative diseases like arthritis. Other contributors may include disc bulges or herniation, sprained ligaments, as well as nerve irritation. You may hear pain described as acute, which means pain is new or lasting less than 3 months. The pain serves as an alarm produced by the nervous system as a signal to protect our body. The pain indicates harm has occurred and signals you to move differently so you can heal. Chronic pain, however, is more complex and not as well understood. What we do know is that the signals in the nerves change and no longer serve a protective purpose. Pain persists even when there is no longer an injury. The good news is the vast majority of pain, whether acute or chronic, can be manageable with the right activities and therapeutic exercises. With the help of your healthcare provider, it can be determined what may be causing your pain. Based on your symptoms, your provider will determine if imaging is necessary. Typically, an X-ray or MRI is not needed during the early stages of treatment. If imaging is ordered, it is important to know that even when abnormal findings are present, these may not be the cause of your pain. Studies have shown that these findings often do not correlate well with the patient's symptoms. For example, did you know that disc bulges or herniations can be the result of normal wear and tear on the body? And while present, some people will never experience pain from this process. What imaging can be useful for is helping a provider determine when spinal injections or a surgical evaluation is necessary. Conservative treatment is our first line of defense against pain. This may include medications such as over-the-counter acetaminophen or Tylenol, or anti-inflammatory medications such as ibuprofen or naproxen. Be sure to check with your provider to ensure that you will not have any drug interactions with the medications you may be taking now. Cool compresses and ice are often helpful in the first 24 hours for pain relief. Warm compresses can also be used to help the muscles relax, which can help to relieve pain. These modalities of ice and heat are even more successful when integrated with small pain-free movements. In the 1980s, we used to believe that bed rest was the solution. This can certainly temporarily reduce pain in the low back area, but newer research shows it actually hinders the healing process. It weakens your postural muscle system and increases the likelihood of similar episodes of pain in the future. Your provider may also recommend an interdisciplinary approach to your pain management through the involvement of other providers. Physical therapy, or PT, is a commonly prescribed management tool. It allows for individual attention to specific needs related to your back pain. It is always best to try a non-invasive approach, such as PT first. Studies show that physical therapy, motion, and time can have a better outcome for lessening back pain when compared to surgery. Early micro movements without increasing your pain is a key factor in feeding and healing your injured tissue. This same principle applies whether your pain is acute or chronic. Tissue heals differently in these stages, but it does heal. Micro movements are your first line of defense if your back pain is not resolving. When the right amount of movement is prescribed for your back, this will make your tissue stronger and healthier and lessen the pain. Physiatry or pain management specialists can assist with diagnosis and management of chronic pain, medications, and possible epidural steroid injections. This is when you need a little bit more help than just movement. Your physiatrist and your PT will work together during this time to help manage your pain so you can return to your activities of daily living. Surgical referrals are only indicated for a small percentage of patients. Of the individuals who experienced back pain and sought medical advice, only 7% of these people required spinal surgery. This is good to hear. Surgery is more likely to be deemed appropriate if there are instances of severe trauma, destructive bony changes, crushing of a nerve, fractures, dislocations, or tearing or leaking of the disc material in the spinal canal. Other adjunctive therapies can be found within and outside the VA that some people find helpful. These are often based on individual preference. Examples of adjunctive therapies may include massage, acupuncture, spinal manipulation, or yoga. The VA may not cover the cost of these therapies, and they may be pursued independently. Treatments such as counseling and cognitive behavioral therapy can also be helpful in the management of pain, especially if you are someone who has chronic pain. These services are available through the VA. Speak with your provider if you have any questions regarding these therapies. Ultimately, even with all these available therapies, it is important for you, the patient, to take control of your treatment and rehabilitation. Before we show you some exercises, here are a few more things that you can do to help diminish your back pain. Weight gain, particularly increased weight around your abdomen, associated with muscle weakness, can contribute to your back pain. Losing weight is not always easy to do on your own, and a nutritionist can help you with this. Stop smoking. This will improve your body's ability to carry your oxygen and blood to your damaged tissues. This helps repair and strengthen tissue. Stopping smoking when it is associated with a chronic cough is also very helpful. The activity of coughing creates increased pressure on the injured tissue and can aggravate low back pain. Getting quality rest is also important for pain management. Be sure to talk with your doctor if you are not sleeping through the night. There are many healing processes that go on through the night if you are sleeping. Finally, exercise is the key component in pain management. Everyone should participate in a home exercise program on a regular basis, especially when acute pain has resolved. What follows is a clear explanation of the importance of pain-free movements to get you on the road to recovery. While minor stiffness or soreness is normal, this program is designed to help diminish your pain. Do not do any of the movements if your pain increases. We want to take you on a progression. Since we are not there, we don't know exactly where you are, and you will have to make some decisions on your own. Remember, none of these exercises should increase your pain. If they do, you may need to go back to your doctor and/or PT for help and guidance. Getting your body weight off of an injured tissue will diminish the pain. These are some typical positions that work for most people. Lying down with your hips and knees at 90 degrees is the position that takes the most pressure off your low back. This is just like taking pressure off of a wound. Taking pressure off this area diminishes pain and allows the healing process to work better. You can stay in this position for 10 to 20 minutes. In an acute case, it is always good to change positions or perform some micro movements if you stay in this position longer than 20 minutes. At home, the best place is lying on the floor and putting your legs up onto the couch. Lie on your side with a towel roll under your waist. This is to support your spine, and it might actually open up the area where your nerve travels. You can sleep in this position. Lie on your side with your painful side up. Put a towel roll under your side. This helps support your spine and opens a space where the nerve is traveling out. This will help diminish your pain. Try different sizes of towel rolls. Some individuals do well with a small one, and others require a larger one. Play with the size until you find the perfect size that helps diminish the pain. You can use this to help you sleep at night. Putting a pillow in between the knees will also help. Stand up against the wall. This can give your back a bit of a break, especially if you are not at home and do not have the opportunity to lie down to take pressure off of your lower back area. This gives your back a bit of a break before you have to walk again. When one of these positions gives you relief, you may find yourself staying there for long periods of time. In general, you may need to adjust or change your position about every 20 minutes, even if you're feeling better. When something is newly injured, changing to a new position continues to manage the pain instead of staying in one position for hours. Micro movements will be your best friends. These movements will help the low back repair. Start using these micro movements after the first day of injury. They will keep blood flowing into the area and get the waste products out. This promotes a perfect healing ground for your tissue to repair. Abdominal squeezes. Lie on your back with your knees bent and your feet on the ground. Tighten your lower abdominal area by bringing your belly button toward the floor. Your abdominal contraction should only be about 20%. Perform this exercise anywhere from 10 to 100 times every 1 to 2 hours, as long as it does not increase your pain. Pelvic tilts. Lie on your back with your knees bent and your feet on the ground. Tighten your lower abdominal area by bringing your belly button toward the floor. Your back will feel like it flattens out. Your abdominal contraction should only be about 20%. It is a gentle motion. Remember, you are trying to heal your tissue, not strengthen it yet. Perform this exercise anywhere from 10 to 100 times every 1 to 2 hours, as long as it does not increase your pain. Side-lying hip rocking. Lie on your side with or without a towel roll under your waist, whichever is more comfortable. Keep your shoulders stable. Rock your hips back and forth. The motion is the same as if you were going to roll over in bed, except you are staying on your side. The motion is only as large as a 1/2 inch to 3 inches of motion. It's micro. Stay out of the painful area. Perform this movement anywhere from 10 to 100 times. The more repetitions you can perform without pain, the better. Lower trunk rotation. Lie on your back with your knees bent and your feet on the ground. Tighten your lower abdominal area by bringing your belly button toward the floor. Your back will feel like it flattens out. Your abdominal contraction should only be about 20%. Rock your knees back and forth 1 inch to 6 to 7 inches. Stay out of pain. This motion should feel comfortable and feel like it's pumping your low back area. Know that even 1 inch or a 1/2 inch of movement helps. The idea is not to increase your pain, but to diminish it. These micro movements for tissue repair should be done every 1 to 2 hours and can be anywhere from 10 to 100 times. No need to count. The better it feels, the more you do. If the pain increases, you do a smaller range or fewer reps. The healthier your tissue is getting, the more repetitions you can do. As your pain starts to diminish, your range of motion will increase. When pain is less or under control, progress to larger motions. Increase any of the micro movements. Walk as much as you can tolerate. This normal compression in the spine helps diminish the pain in most people. Start with 5 minutes, 3 times a day, as long as this does not increase your pain. Then add 5 minutes daily as you can. Once you get up to 20 minutes, you can drop the frequency to twice a day. When you are able to walk up to 30 minutes, walk once a day. Keep adding 5 minutes as you can. Some people may need to stay at 15 or 20 minutes for a week or two. That's okay. Everyone heals at a different pace. As long as you are slowly improving, keep going. Trunk rotation and standing. Stand with your knees unlocked or slightly bent. Squeeze your lower abdominal muscles 20%. Let your arms hang and swing naturally. Twist your trunk side to side. Start with a tiny range and work up to the edge of your pain. Do not go into your painful range. Just go to it. Start with 5 to 20 reps. Work up to 3 to 5 times a day. Unloaded squats. Use this technique to take pressure off your back. Hold onto something stable, like the kitchen sink or a door jamb. Squat down, but pull up with your arms. You should feel weight or pressure off your low back. This should feel good. If it does not, stop this exercise. Try it again in another few days. Hold this exercise for 5 to 10 seconds. Perform this exercise 2 to 3 times for some relief. Throughout the day, whenever you feel you need to take some pressure off your back, you can perform this exercise. Knees to chest. Lie on your back. Feet are on the ground. Pull one knee into your chest. Squeeze it in. Control it back to the table. Do the other side. Squeeze it in, then control it back down. You can progress to letting your opposite leg out straight, like this. This is a larger motion through your back. Be careful. This is a progression to move through a bigger range of motion. Lower trunk rotation. Lie on your back with your knees bent and your feet on the ground. Tighten your lower abdominal area by bringing your belly button toward the floor. Your back will feel like it flattens out. Your abdominal contraction should only be about 20%. Rock your knees back and forth. At this point, you should be able to do a bigger range. Work towards the floor. Still stay out of pain. Remember, pain is your guide. Do not do anything that increases it. Bridging. This is the first exercise you will do to fully begin to contract your muscles around your injured back. First, lie on your back, feet are on the ground, hip distance apart. Squeeze that lower abdominal area. Squeeze your buttock muscles. Lift your trunk off the ground. Slowly lower back to the ground. Don't let your knees drop in. Keep them in alignment. Repeat again. Start off with 5 reps and add 3 to 5 reps until you get to 30 reps. Then add a few sets. Eventually, you may be doing 3 sets of 25 reps a few times a day. Walking. Continue to increase your walking if your back can tolerate it. Work up to 40 to 45 minutes of walking a day. In this stage, pain continues to lessen and doing more motion feels good. Trunk rotation. Perform this standing. Knees are unlocked. Let your arms swing naturally. At this point, Doing your full range of motion with more speed is tolerable. You can also do this on your back. Squeeze your lower abdominals and drop your knees as far to one side as you can. Keeping those abdominals contracted, take them all the way to the other side, then bring them back to the center. Repeat. You can do 3 sets of 30, 1 to 2 times a day. Trunk flexion, knee to chest. In standing, hug your knee up to your chest and balance on your other leg for 5 to 10 seconds. Then repeat on the other side. You can also perform this lying on your back. Trunk extension, standing. Begin to gently support your low back with your hands and lean backward. This is usually the last motion that still may give you some pain. Bend back, staying out of your painful range, then come back to neutral. Perform this 3 to 5 times, working up to 10 repetitions, 1 to 2 times a day. Core abdominal exercise. Dead bug. Lie on your back, feet on the ground, lift one leg up to the 90-degree position. Push your opposite hand on your opposite thigh. Your thigh should be pushing into your hand. You should feel your abdominal muscles contracting. Now try the other side. Forearm planks and side planks. This exercise continues to work your core. Go to the floor onto your forearms and knees. Start on your knees first to make sure that this will not increase your pain. You can progress to lifting your knees off the ground when it does not increase the pain. Squeeze your abdominals in, count to 10. Then increase by a count of 5 if you can. Do 3 to 5 reps, 1 to 2 times a day. Increase the time you hold each repetition for advancement. You can also turn to your side on your forearm. This also works your core. Work both sides. Sitting trunk extension. This exercise will increase your back muscle strength through a dynamic movement. Start with 1-pound weights. Hug them into your chest. Squeeze the lower abdominal muscles. Lean forward, then back up to neutral. Start in a pain-free range and increase to full range. Increase the weight every other day by a half to a full pound if there is no increase in pain. You can make weights by putting dirt in Ziploc baggies and hug those to your trunk. Working up to 10 to 15 pounds is safe and very healthy for your back. Increase your walking distance or time by 5 to 10 minutes each session. Work up to 1 hour of walking a day. Try riding your bike for 10 minutes. You can slowly increase this time as your pain diminishes. You may also be able to tolerate a light hike. Begin to return to your general normal exercise routine, such as a walking program, weightlifting, or hiking. Slowly try activities such as golfing, fixing your car, or hunting. These activities may still irritate your back, but you won't know until you try them. It's always safest if you try a small amount of activity and see how it will affect you that evening. A healthy, strong body will more likely stay out of pain. People who don't have a regular exercise routine generally will have more physical injuries throughout their life. The internet is full of exercise routines that you can have access to, as long as you listen to your own body and stop when something feels strained or in pain. Most exercise is safe for you.
You may want to return to your provider if you have one of these progressively unresponsive symptoms. Pain is increasing each day without relief. You have no positions of relief. If pain is unrelenting and severe, sudden deterioration in balance, or your ability to control movement, increasing clumsiness, or falling over for no reason. Pain that radiates down an extremity that is not getting better. Fevers, chills, or night sweats. Rapid change in urination habits. Your inability to understand this video or complete the exercises. Your physician and physical therapist are there to help you. You have tried these exercises and the pain has not resolved. In closing, we want to make sure that you continue to challenge yourself so you can get back to doing the things you love. Jack LaLanne, a fitness guru, once said, "Anything in life is possible, and you can make it happen." It is important to remember that you are a key player in the management of your pain. You can affect the course of your pain, whether acute or chronic, through daily exercise. Movement and exercise are proven therapies, with benefits that reach far beyond pain alone. Keep up the good work and continue on the road towards a better you.